Hello everyone, this is Dr. Fox, and I'm so glad that you're here with me to discuss the face. This is the first video in a series of videos to discuss the face. In this video, we'll discuss the superficial anatomy of the face. So the face is the anterior aspect of the head. There's quite a bit of shape and contour to the face. A lot of this is the consequence of the underlying architecture of bone and cartilages, the muscles that attach to the bone and various connective tissues, as well as layers of other connective tissues, in particular adipose connective tissues that are distributed throughout the face. We say that the face is really the center of expression and emotion. Such a tremendous amount of nonverbal communication can be conveyed through the face. Another, albeit much less romantically, associated perspective of the face is that it is a collection of fissures. So for instance, we have palpebral fissures. The palpebrae are the eyelids, which there are a pair of upper and a pair of lower eyelids. Then there are the nares, or the nostrils, and then the oral fissure. And much of the actions of the face will pertain to movement about these fissures to make them more or less patent and to change their shape so as to convey expression, emotion, other non-verbal forms of communication. So let's take a look at the palpebral fissures. We'll discuss the orbit and eyes in much greater detail in a subsequent session. But for the time being, let's look at the opening to the eyes, these palpebral fissures. So there are two sides to the palpebral fissure. We call them canthi, or angles. There is a medial canthus and a lateral canthus of the eyes. We'll discuss later the process of lacrimation or tear formation and how those tears move across the eye and drain toward the medial canthus of the eye. The nose is another rather prominent feature of the face. It's an important structure for both ventilation or moving air in and out of the respiratory passage, as well as for phonation and making sounds. So we have obviously the bridge of the nose as it comes down. And flanking the nostrils, we have what are known as the ala. Ala means wing. So the ala of the nose are the wings of the nose. And so that's skin and a little bit of cartilage that is supporting the patency that are the nares. Now, when we move more inferiorly, so if you can imagine deep to the nose is going to be the nasal cavity, and that nasal cavity is divided. So there's a left side and a right side to the nasal cavity. And if you were to continue that nasal septum, which divides the nasal cavity, we would come to this skin-covered portion, which is the nasal columella. That means little nasal column. So that is contiguous with the nasal septum. And as we move even more inferiorly down the face, we'll come to the upper lip and a bit of skin called the philtrum. So that philtrum has a slight indentation, and it is part of the contour of the upper lip. We can also see flanking the oral fissure, these very subtle folds. These are nasolabial folds, and they help to provide definition for various expressions of the mouth. The oral fissure is controlled by quite a few muscles. We'll discuss in subsequent sessions some of the muscles of mastication. Muscles of mastication are the muscles which are driving the movement of the mandible. In this particular session, we'll discuss the facial or mimic muscles. The facial muscles don't control the mandible. They control the movement of skin on the face. Now, various facial muscles are associated with various fissures on the face, and those that are associated with the oral fissure tend to come together and interdigitate their muscle fibers with other connective tissues in an area known as the modiolus. That modiolus can be found deep to the angle of the mouth. So you have an angle of the mouth or of the oral fissure on either side, and you can palpate this modiolus. So you can, with very clean hands, put perhaps your thumb deep on your oral mucosa and your finger on your skin, superficial to the angle, and palpate that, and you can feel where those muscles are interdigitating. And so those muscles, as they act in concert with one another, are going to move that modiolus. So we can affect a smile, or a smirk, or a frown, depending on what those muscles that connect to the modiolus are doing. In addition, we have a mentolabial fold. The mental region is the chin, and the mentolabial fold is the fold between the chin and the oral fissure. And that leads us to our assessment question for this video, and that is, which superficial feature of the face is contiguous with the nasal septum? Is it A, modiolus? No, that has to do with the oral fissure. B, nasal columella? Yeah, I like that answer quite a bit. The columella is the extension of the nasal septum that has skin on it, so that's a great answer. Oral fissure, that has nothing to do with the nasal septum. Palpebral fissure, nope, that's up for the eye. And philtrum, ooh, wow, that's perhaps a correct answer. Let's think about what the philtrum is, though. That's that little divot of skin that's bounded by the columella and the upper lip. And so it's not really contiguous with the nasal septum, but it is adjacent to it. So that's probably our best distractor, but it's nevertheless incorrect. So the correct answer is B, nasal columella. Thank you so much for your time, and I look forward to talking to you in the next video.